Hi, everyone. Thanks so much for joining us today for our webinar, United for Health, an Advocate's Guide to Messaging with Shared Values. We're really thrilled to have you all here today to release our new messaging guide that you'll be hearing a whole lot about both the underlying research and the guide itself and how to apply this in your work. And so just thank you for joining us today. To start on the next slide, I'm going to give you a preview of what the beautiful guide looks like before we dive into today's content. This will be shared following the call with you all, and this call is being recorded, but we ask that you request a recording if you would like it. We will be sharing the guide, which has all of the information that you will be getting in the slides and through the presentation. It's all in there and more. And if you want the recording as well, just let us know, and we're happy to accommodate. So, all right, we're going to go ahead and dive right in. Today's speakers, you'll be hearing from Frederick Assassi, the Executive Director of Families USA, and he's going to be sharing, why message matters and the underlying research we did to bring us to a point where we are uniting for health. Then you'll hear from Patty Wentz, the owner of Wentz Jackson Consulting, who will walk you through how we make it actionable, how we take this messaging research and really apply it to your work. Patty was intimately involved in putting this messaging guide together, and we're really thrilled to have her with us today. And then finally, I will be wrapping it up. I'm Melissa Burrows, Associate Director of Strategic Partnerships at Families USA, and I will be walking us through the next steps, additional resources, and taking your questions. So if you have questions, feel free to put them in the chat through the throughout the presentation, but we will also and then we will answer them at the end. We'll be able to answer some in the chat, and then we'll answer them verbally at the end. So with that, I'm going to turn it over to Frederick, who will kick us off.
Thank you so very much, Melissa. It's a joy to be here with you today and to join Patty as well, and of course all of our phenomenal state partners and national partners out there who dialed in. We are really proud of this moment. We worked really hard on this project and we hope that it will be an enormous help to each of us in our fight to create a more just healthcare environment for our families across the country. And before we jump right into the guide, I just wanted to reflect. This whole work, this project started back in April as we were sort of entering into the dark days of the pandemic. And it was an acknowledgement that we as a country were going through something very profound. It was a shared experience, and it was really with the whole world. And it was really reinforcing the connections between all of us, the ways in which our health is interdependent, and the interplay between health and financial status and race and ethnicity. All those things were coming forward. And so we really wanted to think about how could this moment be utilized to really drive forward a social justice agenda around healthcare. And we got together with Dr. Drew Weston, who many of you probably know. He's a leading light in healthcare messaging. He's a real national thought leader. He wrote a book back in the mid-2000s called The Political Brain. And many really famous politicians cite to it as one of the most important books in the discussion of how politics and our human brains intersect. And Drew worked with us throughout the summer and this fall to build this messaging guide. And it's really premised on the idea that fundamentally, the way our human brains work, we make political decisions either as policymakers or as voters. We make them based on our values, not on rational policy analysis. Really only about 1% of the decision-making ends up in the rational policy-making parts of our mind. It really is much more about the values that we activate, the associations between the values and the words we're using. And if we get this right, we can really build narratives and messages that can carry really powerful policy reforms that appeal across the political spectrum. And that was really the goal, and as the election unfolded and the results came forward, the notion that we have to try something that is appealing to a divided and a splintered electorate and policymaking bodies never became more important. So this guide is really intended to help all of us think about the messages and the narratives that we're using in our work every single day, either in Congress, with federal administration, or in our state capitals, to build narratives that are really appealing to the broadest ideological group, to not just Democrats, not just moderates, but also Republicans, so that we can get a strong enough support base that we can actually get things done. So that's really what this is about. So what do we think is at stake? We really think everything. We have the opportunity to move health reform forward in D.C. and across the nation, despite this being one of the most polarizing eras in generations. But we won't be successful if we're only talking to ourselves. And as you can see in this slide, we'll talk more about this. This is about dial testing that shows how people feel about different messages and policies. And traditional partisan messaging, what you see is it appeals just to the party to which it's been engineered for. And we lose the ability to bring a lot more people with us. So when we shift from the partisan-based messaging to values-based messaging, we actually have the ability to bring true, strong Republicans, persuadables, and strong Democrats together. Next slide. So for real health reform must, we think, do three things. And so all of this work is premised on these three things. One, it has to make healthcare more affordable to everyone in our country, including access to meaningful coverage for every single family, no conditions. Two, it has to ensure that health is available to all in our nation, regardless of if they're Black, white, brown, if they live in rural America, or how they identify and their immigration status. It's got to be available to everyone, and it has to work for everyone. And three, it has to deliver much greater value, focusing on health and not just procedures that make a lot of money for the healthcare industry. And so this entire guide is aimed at anyone who's working for any of those purposes. There are messages in here that will help you build frames, messages, talking points that can really penetrate past the partisanship and bring a broad group of voters or policymakers together. Next slide. So the purpose of this research and the messaging guide is really, as I said, to build effective narratives that can beat the toughest messages from the other side. And what you'll actually see is in testing these messages, which we went into the field in August, we started with the most negative, sort of most effective messages from the other side. And that's how we started our dial test. So we had people really reacting to a very strong negative message. And then these narratives were able to overcome that negative message and actually bring people together. They include evocative statements or talking points that activate the places where people are united no matter their political party. It includes words, phrases, and concepts to use and which to avoid. Next slide. And here's the real challenge. Even in a global pandemic, health has become politicized. It remains so highly politicized. Opponents like pharmaceutical companies and others in the healthcare industry already are working to frame health reform as so-called socialized medicine. And ideologues on the right and left are keeping us divided and preventing common sense reforms, like stopping prescription drug companies from constantly increasing prices and making sure that our health insurance premiums and costs are more affordable, not out of control. Next slide. So it's really important. This research is deeply embedded in neurological science. It is a recognition that the way that we understand information as human beings is associative. It's connected to where we store our memories and how we learn. And so the way we say things, the order that we use, the things that are associated with the words that we're using all trigger a values response and the way in which people will either support or oppose potential policies. So while we can find common ground, different words and sequences of words trigger different responses. So no matter the topic, science teaches us that our values drive political responses, not policy arguments, and it happens in a nanosecond. And that's what this is really built upon. Next slide. So this is just a little example of the ways in which these associations can all fit together. The green ones are the desires and the red ones are the fears. And so depending on the words you use and depending on the sequence, are you activating things like people's belief in choice or high quality care, affordable care, comprehensive care, health care for everyone, a solid basic plan no matter what happens, problem solving, real bipartisan solutions, or are we activating things like losing what folks already have, insecurity, high deductibles, premiums, and copays, high prescription drug costs, socialized medicine, and anger that nothing has been done. Next slide. So to build the strongest messages, it's a 1-2-3 recipe. The first is make sure you're activating the right neural networks. You're using the words that trigger the correct, the most effective associations. 2, speak to values and emotion. Lead with values and emotion, not with policy. And 3rd, tell coherent, memorable stories. I think so many of us have been looking at this for decades. This is very intuitive. We've lived this. We've sat in the halls of Congress or in state capitals, and we know that as we approach folks, if we know who they are and we know what they value, we start there. We really focus on activating for them what they care about, and we try to tell it through coherent, memorable stories. And I can say that when I was working up in the Senate, there's so many moments where both for myself personally as people were lobbying me, and then of course watching the senators and the chair people of the committees of jurisdiction working, it was those memorable stories. They always anchored so much of the debate and the dialogue in. This is really powerful stuff. Next slide. So what we did is we went to a national representative sample of voters that were either one of 3 things, either very strong Democrats, very strong Republicans, or persuadable. Not independents, but actually they could either be Democrat, Republican, or independent, but they were actually persuadable, meaning they didn't identify as staunchly one or the other. And we started with the negative message, and then we went into the message that we worked with Dr. Weston to create. And we refined them over time, but the messages were read to them. They were about 90 seconds. And as the voters heard those messages, they just simply moved the dial. They moved it up if they liked what they heard. They moved it down if they didn't like what they heard. You can often see this during debates, like on CNN, these sorts of dial tests. And so what you're about to see is what the messages are, the ones we finalized, and where the dial test took us and how it brought a really wide ideological group together. And just a last point, which is this is not polling, and there's sometimes confusion about that. Polling is simply it's typically we put a policy in front of either a policymaker or a voter and say, how do you feel about this? That this is not that. This is the opposite. This is starting with the value or the narrative and saying, how do you feel about this value or narrative? So that underneath that, we can actually fight hard for the policy. And the policy might be Medicare for all. It might be Medicare for who need it. It might be a Medicaid buy-in option. But it's a frame that's very durable, that can withstand the attacks of industry or arch conservatives, and will allow us to get as much accomplished as possible because it brings everyone together, or most everyone together. Next slide. And so in general, when you see this kind of message testing, the dial testing, messages that test over 50% are considered very strong. Our research found strong messages that test over 70% across all political ideologies. So this is kind of a home run moonshot moment where we've got these messages that are so powerful. Next slide. So that's it from me. Just really want to thank everyone for dialing in and for participating in this. We really hope this guide is useful to all of us. And now I'm really excited. We're going to hear from Patty Wentz, who was an amazing architect of the guide itself, and is going to walk us through how it's organized and how we can all use it. Thanks very much.
Hi, everyone. I'm really excited to be with you here today. Let's go ahead and move it to the next slide, please. So how do we tell a successful policy story? Frederick talked about the importance of storytelling. Again, and you're going to hear us talk about this over and over again as we present this work and as we talk about this guide. It is about connecting with values and also metaphor. And one of the things that I think about when I think about connecting with values and metaphor, I don't know how many of you were fans of the TV show Mad Men with the advertising executive Don Draper, but there's a great and iconic scene in that show where he's trying to sell a slide projector, a carousel for a slide projector. And instead of talking about the technical aspects of the carousel the way the client wanted him to do, he turned it into a narrative about family and love and longing for the people who are no longer with us, but we can remember forever through a photograph. Those things are universal for all of us. And for healthcare, we want to be talking about the things that are universal for all of us: choice, high quality, affordable, and comprehensive care. And I know we've all been talking about that for decades, but maybe not always from a value-based perspective in a way that reaches people's hearts and triggers their associations in their mind. So when connecting with those values, again, as I mentioned, it's helpful to have a story or metaphors such as we all deserve the same quality of care. That's a way to say high quality care, but it puts it in a fairness frame that resonates with people. And we all deserve a family doctor. That's talking about universal access to care. But instead of conjuring up images of insurance coverage, it triggers feelings of safety and care and personal attention. And this won't surprise you, but when telling policy stories, we also need to explain to people why we don't yet have the same quality of care. And that's because there are people and institutions or systems who are in the way of success. And it's important for us to articulate the barriers because once we name them, we can overcome them and hold them accountable. And these people or the system is standing in the way, but together we will win against them. And of course, we can't stop there. We have to give people hope. So in our messaging, we want to show what the path to hope is, including the values-based solutions that we are all working on. Next slide, please. I'm sorry, I'm having a problem at my end. Okay, so in the research, it was clear that no matter what political party we identify with, we are united around these three beliefs. Every child, every family, every individual should have access to quality, affordable care and shouldn't face financial ruin if they need care. Too many people have been shut out due to cost, coverage, or color. Leaders must come together and finally fix the problem once and for all. Next slide, please. So what we learned in the COVID context, the research shows that COVID has raised awareness about the flaws in our healthcare system. But to be effective, we have to talk about it in the broader context and not just about this moment. And we do have some examples in the messages that are coming a little bit later. And although messages focused on health equity and what we all call social determinants of health still tend to not fare quite as well as healthcare messages, they are getting stronger than in the past. People are starting to understand the disparities and lack of upstream prevention and the socioeconomic issues. So that's really fantastic. Next slide, please. So how to use this guide. One of the things that normally happens in message trainings is that people like me present 3 talking points on a policy and tell people that these are the talking points you have to say. You say you can only say these about this policy and you cannot stray. This message guide is slightly different in that it isn't focused so much on specific policies but more on the big picture that we know Americans are aligned around and provides many paths to get there, including some messages that I certainly have never used before but I'm really excited about and work with persuadable voters. And in the guide we have short, very short sound bites, a variety of talking points, and some longer messages. Next slide, please. A couple of takeaways for all of us as we were working together on this guide to highlight before we get deeper into it. I think as Frederick mentioned, we are not going to be successful if we're only talking to ourselves. And we also want to make sure that we are using language that is inclusive, that we are talking about we and us when talking about who will benefit from health reform as opposed to saying they and them. We are all in this together. And as we mentioned, facts don't move people, values do. And in meeting people where they are so that they can hear our messages, we don't want to make people work too hard to hear us. The dial test revealed, for example, that when talking about Medicare and Medicaid, we want to put Medicare first or we'll lose some support. People know it, trust it, and feel good about it, whereas Medicaid is not quite as universal. And we don't want to be too specific on numbers. You know, as policy folks, we're accustomed to being very specific on numbers in our reports and in our testimony. But frankly, that loses the general public. And whenever possible, it's helpful to provide context instead of percentages. So say, for example, 1 in 4 people as opposed to 23.7%.